Good afternoon. It's officially afternoon for almost all of us at this point. My name is Grace Rubenstein. I'm Editorial and Communications Director with Health Begins, and it's my honor to welcome you today to this Health Begins webinar on political participation and health equity. So just before you start, a few housekeeping items for you to note. Next slide, please. Yep. This webinar is going to be recorded, and we will be sharing the recording and slides with you after the webinar. So don't worry about trying to jot down every single note while you're listening. You as participants will have your lines on mute during the webinar, but it's really important to us that this be a dialogue. So we're going to be very present in the chat. We encourage you to drop questions that come to mind into that chat window at any time. We'll be responding to those in writing, and then also making time, quite a bit of time today actually, for a robust discussion about them at the end of the presentations. Just to make sure everybody's warmed up. Great, I see a lot of you have jumped in to the chat already. Thanks to my colleague Vince there. Let's just give it a little test run. If you are with us and you can tell us your name, your organization, and what region you're from, we'd love to see who's in the room with us here. Let's take a look. Appreciate, great. I see all of you coming in now. Philadelphia, DC, Colorado, wonderful. Portland, so good to see everybody here. So this is a 1-hour conversation, and we ask that everybody bring respect, curiosity, and joy. We're going to do our best to bring that too and help us all walk away with a lot of fantastic ideas and resources. Next slide. So our objectives for today are part of what brought you here, of course, are going to be to explain how civic engagement and political enfranchisement are significant drivers of health equity and really connect those dots to Medicaid beneficiaries. To make the case for healthcare's role in facilitating civic engagement and enfranchisement, not an obvious idea to everybody. We're going to dive into it. Identify mechanisms and opportunities within Medicaid that can be used to support civic engagement and enfranchisement among patient populations. And finally, to apply strategies and innovations that are already in use. We're going to hear about some of those right here to support civic engagement and enfranchisement among people enrolled in Medicaid. Next slide. I get the honor here of introducing a really wonderful set of panelists who are approaching this from a number of different directions, which is going to make this really enlightening hour. We have Manisha Sharma, co-founder of the Civic Health Alliance, Lizette Escobedo, Vice President of Government Relations at Ultimate Health Services, and Douglas Hess, who is currently Director of Research at the American Physical Therapy Association and also has been working to implement the NVRA for 30 years, not a short time. Next, please. It's my privilege now to hand the mic over to our host and facilitator for today, Health Begins CEO, Rishi Manchanda. Rishi?
Grace, thank you so much. And thanks to everybody today for joining. It looks like we have a growing number of folks who are joining live. So thank you again for taking time today to join us for what is a really exciting conversation around health equity, Medicaid, and civic engagement, topics that we sometimes don't hear discussed together. And I want to just spend a couple of minutes level setting and orienting everybody to why we're having this conversation, why we thought it was so important, and why we're excited about the presenters and the panel that we're going to have today. We go to the next slide. As a kind of quick orientation for those who may not be familiar with Health Begins, we're a national mission-driven firm that helps Medicaid serving health plans, health systems, and community-based organizations to work together to exceed all the growing healthcare equity and social needs requirements in the Medicaid space, but to do so with a deep public health and structural analysis to be able to achieve not just compliance with new requirements, but real long-term impact for communities harmed by societal practices. We've had the privilege of working with a number of courageous leaders across the country, and as you can see, last year in 2023, worked with folks across 29 states. If we go to the next slide, because of our focus and our mission really to advance health equity, including the ability to address the social and structural drivers of health equity, We are excited about this conversation because we know in this moment, especially in this election year, and for many years, especially when it's not an election year, when people aren't thinking about voting, that there's always been, and there still are, many opportunities to promote nonpartisan civic engagement, nonpartisan voter engagement, especially among people enrolled in Medicaid. We're going to hear from some of our presenters today about why that's so important and relevant for Medicaid. I mean, we also know that these opportunities exist, and you'll hear them discussed today across different levels. There are opportunities to engage healthcare professionals and patients to be able to promote civic and voter engagement. There are opportunities to embed civic engagement into the operations of healthcare delivery. So it's not just individual to individual, professional or patient level work, but it's really institutional level embedding of civic engagement. And there are also opportunities, of course, at a state and even federal policy level to be able to streamline civic engagement, to create more opportunities for people to exercise their right to vote. And so these opportunities are things I'd invite you to listen to today as we hear from our wonderful panelists. And as we go to the next slide, it's important to understand just a little bit about why this matters for us at Health Begins and why I know everybody on the panel today is excited about this work. Fundamentally, we know that inequities in political enfranchisement and inequities in health outcomes are interrelated. There are gaps between who has the ability to vote, who is able to exercise the right to vote, and who has the ability to engage in civic discourse and political matters, and those who are also able to access opportunities for health. These phenomenon of inequities in health and inequities in the civic process are very interrelated. And there's years of now evidence and research to suggest that relationship. We also know that through state waivers and national policy initiatives, that Medicaid is increasingly becoming a mechanism to help advance health equity and, of course, address social needs and other drivers of health equity as well, issues like food and housing. And so while Medicaid is now becoming increasingly relevant to questions of health equity, it's always been a health equity intervention, but now even more explicitly. We wonder what it means to come to this question of civic engagement as we understand it as itself a social driver or social determinant of health equity. And the question that gets raised is, what is Medicaid's role in advancing civic engagement and political enfranchisement? You can see some snippets of really powerful research articles. We'll put links to this in the chat today that really speak to this relationship. Wonderful work from Jamila Michener, professor at Cornell, and who's done a lot of research in looking at the relationship between Medicaid, specifically in the act of enrolling in Medicaid, and the correlations to voter registration and voter turnout. You'll also see some interesting research, including some research from Oregon, looking at the impact of Medicaid expansion on voter turnout as well. So there is a relationship over here, and sometimes it's an underexplored or underappreciated relationship, especially for many of us who work in Medicaid. Today, that changes as we now dive into this topic. And with that, I think to start us off with our presentations, let's go to the next slide. It's my honor to start off with our first presenter for today, Douglas Hess. We've come across Doug's work and phenomenal research just recently at Health Begins, and really excited, Doug, for you to join us today. So I'll turn the baton to you to kind of kick us off. And we'll go through about 7 or 8 minutes of each of our presenters, starting with Doug. We'll go then to Lisette, and then to Manisha. And then, as Grace mentioned, after opening remarks from each of our presenters, we'll come back into a fireside chat conversation. And that's, for our audience, particularly important reminder to please send in your questions so that we can try to facilitate asking those questions in our fireside chat. With that said, Doug, I'll turn it to you.
Great. Thank you, Rishi. Again, so my name is Doug Hess, and back when some voting rights laws were passed that I'll explain in a moment related to Medicaid and voter registration, one of my early jobs in my career was to work on implementation in the states around these policies, and I've been doing that on and off. Currently now, though, I'm not working on that directly. I'm Director of Research for APTA here in DC. But the next slide. So I'll cover just these 3 areas. There is this link here for a report that I wrote last year for the Institute for Responsive Government. We'll talk about them later on in the presentation also. They're doing some work on helping Medicaid programs in states implement what's called automatic voter registration. And I'll explain that in a moment. But the report that I have there also has a lot of background information on voter turnout, voter registration rates amongst different populations, barriers to voter registration, and how the National Voter Registration Act and automatic voter registration in Medicaid relate to these problems as potential solutions. Next slide. So, well, we know that tens of millions of people aren't registered to vote. In broad brush terms, those people tend to be folks who have moved recently or move frequently. They tend to be younger people, and they tend to be people with lower incomes. Those groups have quite a bit of overlap, of course, but we also know there are groups like people who have disabilities or groups such as new citizens that also have lower registration rates. Depending upon the election year and the group we're talking about, these gaps can be enormous, though, up to like 20 percentage point difference in registration rates between some groups compared to wealthier groups. Section 7 of the National Voter Registration Act, or NVRA, not to be confused with the Voting Rights Act, the VRA, but the NVRA was passed in '93, signed by President Clinton. Section 7 of that law, and it's a very complex law, but Section 7 says that programs like Medicaid have to offer voter registration when someone applies, recertifies or renews, or if they inform the Medicaid agency of an address change. At those times, they are to be offered voter registration forms and assistance with them, including transmitting the forms if the person wants to leave it with the office. Now, of course, back in '93, everything was in paper. People went to offices physically. So things have changed over time. But still, the idea is that a voter registration application has to be there. They cannot say to you, do you want to register? And if you say yes, then they give it to you. That sounds logical, but that's actually not how the law works. And there's good reason for that. When states do that, they end up, the forms just vanish. Someone says, yeah, I want to register. And they say, well, the county clerk's office is down the hall and 3 floors over or whatever. They have to have it there. It has to be in the packet. If it's mailed to you, it has to be mailed to you. If it's online, there has to be something incorporated online, either as part of the PDF or something more than just burying it somewhere. There are certain language that has to be included also in these applications. And if implemented optimally, it can register millions of people and, as importantly, keep people registered as they move. A huge problem with voter registration in the US is that people move a lot and you have to keep yourself registered. Change of address forms, if they include voter registration, will go a long way to helping us fight that problem. States have repeatedly been found to implement this poorly or even just not at all. States have just sometimes stopped doing this voter registration program required by federal law. I'll point out here that for complex reasons I won't go into, there are 6 states that are exempt from the law. They could voluntarily implement it, like Minnesota is doing some of this voluntarily. Those states are listed there: Idaho, Minnesota, North Dakota, New Hampshire, Wisconsin, Wyoming. Well, North Dakota doesn't really have voter registration. Other states were waived because they had election day registration back in 1996. States that have since included election day registration still have to implement the NVRA. They're not let out of it. Next slide. So as I said, these are the transactions that must be covered. The programs that are covered are Medicaid, SNAP, aka food stamps, WIC, TANF, other cash assistance and programs your state may have. They may call them different things. State-funded programs primarily serve people with disabilities, even if that service is provided in the home. If you apply for the benefit at your home, they have to offer you voter registration at your home. States can also include other programs that they choose to. So again, it's when people apply, recertify or renew, and change of address. You can go to this link at the DOJ to read more about it. They have an FAQ about the law there. Next page. So the bad news is, in the past 20 years, we've found 22 states, so half the country, has been violating the law, sometimes very egregiously, sometimes more than once. We found them violating the law. They fix it, then they go back to violating it a few years later. And it's a law that just keeps, we can talk about later why this might be, but it keeps getting ignored. The good news is that whatever barriers there are to implementation, some state has faced it and some state has solved it. So it can be fixed. It's not an expensive fix. It can take time, but there are short-term solutions also. And they can lead to huge increases in voter registration. You can read about some successes in that report that I wrote that was on the link earlier. Common problems, again, include simply not including the application with the material, not doing it for remote transactions like online or over the phone, not including all the language that's required by the law. And election officials and agency officials don't normally communicate. This is the only reason they would have to communicate. So there needs to be some administrative management work done in most states to make sure they're talking to each other, that agencies, for instance, aren't using the old voter registration application by mistake, or that they update their software and forget to include this in it. So we need to have some managerial solutions in states when they're found to be violating the law. When it works well, roughly 10% of all voter registration applications in your state might come from these agencies when you add them all up. A lot of people are surprised by that, probably not this audience, because we all know how big these programs are. A lot of folks don't imagine these programs are that large. Okay, next slide. So the second path to voter registration in Medicaid agencies, that was the first path. States have to follow the NVRA. It's a 30-year-old federal law. They can't get out of it. They can, however, go beyond it and do automatic voter registration. The Institute for Responsive Government is who I would suggest contacting if you're interested in this issue and want to learn more about it. You can also go to the National Conference of State Legislators website there and see what states have automatic voter registration in Medicaid. Some states have specifically said so. Some states have said the Secretary of State can choose additional agencies, so they choose Medicaid perhaps. Some states have implemented it kind of without legislation. They've sort of administratively implemented automatic voter registration. But the idea here, optimally, what the Institute calls SAVER, Secure Automatic Voter Registration, means that because Medicaid checks citizenship for everybody in the household, it could automatically submit everybody to be registered to vote if it's an update or if they aren't already registered. And then send them confirmation of this, which people can then opt out of or refuse or choose a party or do whatever else they need to do on the back end. So the benefits of this is that we don't have people accidentally registering who aren't citizens. Also, the citizenship check is a nice way to fight off beliefs in sort of fraud by saying that this is, citizenship check is happening. It reduces the burdens on the applicant, and it could also reduce the state from exposure to NVRA litigation in the future. So we've sued tons of states for failing to implement the law. If they do this, there's a good chance that they do it right, that they can have this process happening more smoothly and thus avoid violating people's civil liberties or civil rights. Next slide. So what to do next? I've gone over it by 2 minutes already, so I'm talking very fast. I'm happy to answer questions later or point people to other publications. So if you're interested in automatic voter registration, again, this is something your state has to choose to do. This is sort of an add-on to the NVRA. I would suggest contacting the Institute for Responsive Government. They okayed my putting their email up there, so feel free to reach out to them. Also, not every state's going to pick AVR. Some states are still waiting to implement it because they're waiting for some federal action that would help them implement it. See if your state Medicaid form or food stamp forms, et cetera, include voter registration. If they're in violation, talk to those agency heads, send them a letter, send it to the Secretary of State or whoever your chief election official is. It's usually Secretary of State, but not always. You can send it to the Department of Justice also. You can try and see if your state ACLU chapter is interested in this topic, or they might refer you to some other civic organizations or voting rights organizations that might be able to get engaged and work with your state to fix this issue. I'm happy to also talk to people informally. This isn't what I do for my job anymore. But if you Google my name, you can find my website, find my email, and reach out to me. And I'm happy to do a little informal advising or try and find someone who could help you with more resources. But I'll leave it there for now.
Doug, thank you so much. And I know in the panel conversation that we're going to have the fireside chat, there'll be opportunities to come back to some of these points. Really appreciate this. Let's go to the next slide here and hand the baton over to Lizette Escobedo from Ultimate Health Services. Lizette, welcome and thank you so much.
Actually, I should unmute. That'd be helpful. Next slide. So I'm going to talk a little bit about the work that we do at Ultima to integrate civic engagement into our service provision process. And so I'm going to go through the why and the how of this work. And so for those of you who don't know, Ultima is one of the largest federally qualified health centers in the country. We serve about 500,000 patients and have about 5,000 staff in both Orange County, LA County, in the state of California. But really what I want to amplify here is really our roots in social justice. We actually came about as a Barrio Free clinic where our current CEO, who actually was the CEO at that time as well, really wanted to address the issue of access to healthcare as a human right, specifically for Chicanos and Latinos in East LA. And so we really looked at what were some of the social determinants of health, how we addressed that, and really how we made healthcare accessible to everyone in our community who otherwise would not have had access. And so there, Ultima was born and became the FQHC that we are now. And so these social justice roots are important to tell this story about why we got involved in the civic engagement work to begin with. Next slide. And so who we serve at Ultima, 94% of our patients between ages 18 and 64, majority Latino, about 77%. 65% of our patients are either insured through Medi-Cal, or 19% are actually uninsured. And we serve everyone, as folks know, that is the role and responsibility of FQHCs. We have about 60 community clinics throughout, again, both LA County and Orange County. And I talked a little bit about, our patient density or whatnot, but I think the main points here is who we serve, right? 77% Latino, 65% Medi-Cal, 19% uninsured. And I'm going to explain over the next few slides why this is critical in the work that we do. Next slide. And so one of the things that we decided to do with Ultima, because in order to get the FQHC designation as a federally qualified health center, we have to meet certain criteria around social vulnerability index and making sure that we're serving low-income communities, communities of color. And so when you map out where our clinics are located based on those standards as FQHCs and based on our social justice roots as Ultima, one of the things that we did is we overlaid that with where are the hardest to count census tracts, where do we have the lowest voter participation in our community, where are the regions considered civic deserts by various standards. Loyola Marymount has a really great study around this, and where we had the highest COVID-19 mortality rates, or at least access to vaccinations, and we are in the epicenter of all of that social justice work. And so with that correlation, we understood that in order to have access, in order to address healthcare issues at the core through policy and through elected leaders, we had to get involved in civic engagement work to ensure transformational change in the communities that we're serving. And so this is really telling, and I'm pretty certain that if you map other FQHCs all throughout the country, you're going to see some very common epicenters with the intersection of low civic participation. Next slide. And here, one of the other things that we did is we actually mapped out where there's also Medi-Cal eligibility that is greater than 20%, and that is also where we're located. And in my next couple of slides, I'm going to also touch upon why this is important. In 2022, registered voter turnout was less than 60% of the county average in these particular areas. So where we're serving community and where we have the majority of Medi-Cal beneficiaries is where we have the lowest turnout percentage comparison to the overall county turnout, as folks can see here. And one of these areas is Southeast LA, which is also one of the areas where we lost the congressional district during the 2020 census. So by way of lack of civic participation and lack of enumeration in the census, we are losing resources, funding, and representation. Next slide. And so I did another comparison here, and I know Doug did this with the voter registration piece here. We actually looked at where do we have overrepresentation of Medicaid recipients, right? In our case, in California, Medi-Cal. And what are the folks who are also represented in terms of patients for FQHCs? And as you see here, the majority uninsured or insured by Medicaid, the majority low income, majority tackling issues of affordability or housing. And when you look at the other end on voting and income, you see an overrepresentation on folks with high income, right? 77% of eligible voters who usually vote in elections have an income of over 6 figures. Folks who have less flexible work schedules, transportation barriers, have to deal with polling closures, et cetera, are part of the voter purges, usually happen to be also those folks who are lowest income and most historically disenfranchised. And so when we're looking at who are making the decisions around policies and electing policymakers and really engaging in that democratic process, there is an underrepresentation of folks who are Medicaid beneficiaries and folks who are being served by FQHCs like ours. Next slide. And so what did we do? Our response was our My Vote, My Health effort, which is an integrated civic engagement model. We actually decided to use our Ultimate Health Services clinics as hubs for civic engagement. So we look at the opportunity to engage patients in conversations around their civic health, whether it's an election, whether it's census enumeration. We do this through our providers, through our clinic staff. We also engage our 5,000 staff in the same process, having these conversations, having them understand when their elections, making vote centers accessible to them, specifically in LA County and Orange County. And then we run canvassing efforts with CBO partners where we do doors, phones, and texts within a 10-mile radius of all of our clinics. For those patients that we didn't get in the clinics, we're able to contact them in their homes. Next slide. And so here's the impact of our work, right? We're seeing the impact by how many folks we're able to speak to, how many ballots are cast in the voting locations that we're hosting, clinic impressions. And so we know that our model works. And next slide. And our model has been validated by various institutions that we've worked with. We've worked with UCLA, UCR, Loyola Marymount to really validate that our role as trusted messengers, that the way that we've implemented our model has really helped increase turnout within 1 to 3 percentage points to other folks who were not contacted by our work in these particular areas. Next slide. I'm going to try to wrap up, but one of the things that we decided to do is I explained the why, I explained the how, and then we said, how do we also expand this statewide so that this becomes a movement of FQHCs, not just the work within Ultimate, but within the state and even nationally. And so this year we were actually proud that we partnered with the California Primary Care Association, thanks to the support of the California Endowment. And we're expanding the My Vote, My Health integrated civic engagement models amongst 6 regions throughout the state of California. We're engaging 11 community health centers, 9 community-based organizations, 6 regional consortia. And I saw some folks logging in that are part of this movement. And so my kudos and hellos to folks who are part of this in order to do this statewide. So have the impact that we've had, but all throughout the state of California during the 2024 elections. Next slide. We've also engaged our providers. One of the big benefits of this work is, as you all know, at FQHCs, we have very passionate providers in serving the community. And so we've started our White Coats for Change, where we actually have our doctors come out and canvass with us, do the trainings with us. And so this has been a really good opportunity to also engage our providers in this work. Next slide. I promise I'm going to wrap it up really fast. And so some of the learnings from this work. One, it really is important to address the correlation between civic engagement and health outcomes, which we call civic health within our organizations. It's important to understand the role of trusted messengers, specifically providers, nurses in this work. This has been validated by various research, by NALEO, by Cal State LA, that these are the most trusted messengers, specifically amongst communities of color. It's important to engage your site leadership for those of you who have hospitals, community health centers in this work and in this process. Developing turnkey tools and materials is really, really important for this work, especially for folks who are newer to this. And so we're going to talk a little bit about how to get started, I know in a couple of slides. And then incorporating evaluation, analysis, and understanding what is working, what is not, and how do we implement it, scale it up, etc., has been really helpful for us. And then celebrating and identifying civic engagement champions within your organizations to help bring others along is absolutely critical for this work. Next slide. I think that's all on my slides, but there you go. That's it for me, Rishi. I'll give it back to you.
So thank you so much. And I know there's a lot of good now conversation and questions in the chat. And so thank you everybody for engaging in the chat, and Lizette for that wonderful presentation as well. Last but certainly not least, Manisha Sharma. Manisha, co-founder for Civic Health Alliance and a dear friend. Manisha, I'll turn it to you as well to kind of share your perspective.
Thank you. And it's really an honor to be here with our esteemed colleagues, Doug and Lizette. Thank you so much for all your work. Next slide, please. So just to let you know, I'm a social medicine, family medicine physician. Majority of my career has been to serve and have the honor to serve folks who are uninsured or who receive Medicaid as their insurance. I don't like to look at it as insurance, as it is a lifeline in many states, and thinking through how we actually serve our communities. And I also want to set this up by also saying that context matters, and just understanding the historical context of how Medicaid has been set up in the United States is really rooted a lot in othering, and it was designed to other folks who are vulnerable and disenfranchised by the system. And so I love this Alice Walker quote, which says the most common way people give up their power is by thinking they don't have any. And that is really a lot of really to set the premise over why it's most imperative to really thinking about voter registration within Medicaid settings. Next slide, please. So I'm going to give you a perspective based off of mine as a physician serving our communities. And I just want everyone to understand that health disparities in this country is echoes in civic disparities. So if you are disenfranchised by the system of where you can't vote, when you can vote, it's really important to understand that those disparities and civic disparities echoes also within health disparities. And because the healthier tend to be wealthier, and they tend to vote more, and they vote for policies that advantage them. Next slide, please. So I wanted to kind of break some myths down in regards to why this is important in the health space, why it's important to be in spaces and places, and why we need to register people to vote in our day-to-day work. And so one of the myths, as Doug brought up, is that you can't register people to vote because it's against the law. And as our esteemed colleague Doug told us, next slide, please, that this is actually there's precedent set. It is not against the law. It's as Doug mentioned, the NVRA, but it's also built into HRSA, which is where Lizette's settings are for FQHCs. It is also built into the IRS code, which is also important to understand. Is that there is an obligation to actually think about creating spaces for people to enact their civic engagement. Next slide, please. The one thing that we hear a lot is, well, no one wants to hear from us. And so, and that is also I want to, burst that myth. Part of this is, again, the Alice Walker quote. It's designed to think that people don't want to hear your voice, but actually really what it is that politicians do pay attention to who is registering people or who is registering to vote. They pay attention to the communities based off of the registration. And so your vote does count. And really getting people to understand that their voice needs to be heard, and that people do pay attention really matters. And this also includes in health spaces. Doctors and nurses tend to feel in the system, being disenfranchised ourselves, that our voice is not heard, but we actually hold a lot of power, and the voice of the people are really, it's really what holds democracy accountable. And so I just want to sort of burst that myth, because it's really important to understand that elected officials pay attention to who and what counties, what zip codes register to vote. Next slide, please. And then the other one that's really amazing, and it sits very much in our space as physicians and nurses and anybody who's in the health diaspora, but really for physicians, that doctors should not be political. There is a new bill that's coming out by, I think it was a congressman in New Jersey who was saying banning DEI and banning any type of inclusivity in medicine. But really, to be honest with you, doctors not being political, everything is political. As my co-founder and dear friend, Dr. Stella Saffo, always says, health is in all policy. We see the bodily impact of bad and good policy and bad and good systems in our exam room. So if you don't think that this is not political, well, I'm sorry, and that we shouldn't be political, we see the manifestations in our exam room. And I always think about Rishi here. Rishi was early on in my career was a mentor for me, and really thinking about voter registration in our spaces and places of healthcare. And and he always used to say, well, we ask people, do they wear a seatbelt? We ask people, do they smoke? Why can't we ask them if they're registered to vote? And I want us to understand that seatbelts and smoking and vaccines were political issues. And so they are now preventive care. And so it's really important to understand the connection and understanding that as a physician, it is our responsibility to actually think through this in a political fashion, because it's all politics and it's all political. Next slide, please. So Civic Health Alliance, who we are, just so you know, we were 4 doctors who really had this vision of really saying, okay, well, we just heard about policy. We've just heard about how people do the work on the impact in the ground. But the question is always in the how, and really trying to change hearts and minds of big organizations and systems that we are all involved in, or we are all adjacent to, and really getting them to think about why this is important, and really falling in line with Healthy People 2030, how civic engagement is a part of health. And so this is how we were born. Next slide, please. So a lot of the work that we do is really getting to meet you where you're at, and really thinking about strategic ways to change hearts and minds, in big spaces of systems design and shift, as well as really we have those organizations also have a voice in political testimonies and in political spaces of government. And then also really thinking about how to do this where it meets your community, your healthcare setting, on how we can do end-to-end transformation, and really thinking about that strategy. Next slide, please. And so just we're an organization that really thinks about this through the lens of clinical care delivery. And next slide, please. And so we have a lot of tools and trainings on how to help you think through your space and place, and how to actually look at this, how to think through the talking points, the frameworks, the strategies, and how to really build it where you're at. Because as we all know, each zip code in each community is different and unique, and we celebrate those things. And Civic Health Alliance allows for us to be able to partner with you in really thinking those collaborations of systemic scale, of really changing and shifting hearts and minds in really registering people to vote. Next slide, please. And thank you for your time.
Manisha, thank you so much, and to Lisette and to Doug as well. There's been a lot of really good discussion in the chat. I encourage everybody who's online right now as well, just to, if you didn't share your questions yet, please do feel free to share any questions in the chat, and as well as resources. If you have resources you want to share based on your own experience and your own work, please feel free to share what you're doing, or if you have thoughts about some of the comments or questions in the chat, we invite you to dialogue with each other. Let's shift over now to kind of a panel conversation here, really a fireside chat, and I'll keep the slide up for a moment here, then we'll take it down for a few minutes just to have a kind of face-to-face chat, if you will. We've now heard from Manisha, from a provider perspective in particular, and a global perspective, what it means for healthcare professionals to do this work, especially as we bear witness to the downstream impacts of of the political determinants of health, right, in our patients' lives. We've heard about what it means to actually have a healthcare system and Ultimate be able to really embody this from the get-go, this approach to civic health, and demonstrate ways to now operationalize this in a really robust way with 2.3 million, I think I saw, voter engagements or impressions, Lisa, as you mentioned. And then we've also heard about ways at the federal level and through the state level to be able to help streamline civic engagement from Doug through compliance with the NVRA, as well as efforts to go beyond the National Voter Registration Act and do an automatic voter registration as one example of the path. So really wonderful examples and opportunities here. And my first question really to each of you, we'll go around the horn here, and maybe we'll go backwards from Manisha to Lizette to Doug. Given the wonderful, rich kind of history and work and impact you guys described, in this moment, what challenge or barrier concerns you the most? Quick answer, go around the horn, and then we'll come back around as well and ask what gives you hope in this moment. And then certainly we'll want to make sure that in this dialogue, we hear from each of you to share at least one additional or concrete tip or resource, or you can go back to one you've already shared and highlight it. What's one resource or concrete tip that you would want to share with somebody looking to learn more? Let's go around the horn and ask those questions, and then we'll come back to the questions that are coming in the chat. So Manisha, we'll start with you. What concerns you the most, a big challenge or barrier right now in this moment? And we'll go around to Lizette and Doug.
Apathy. That's, to me, is what's challenging. We have a lot of folks in the space, especially in Medicaid, who really want to do the right thing with good intention, but feel that they really don't have a voice, but also feel like, is this important? And I think it goes with the political wins. And I think apathy versus looking at it as urgency is really what worries me.
Thank you so much. Yeah, Lizette, what do you think?
So I have two. I think one is lack of sustained engagement. There's this sense that you can kind of drop in 6 weeks before an election and try to turn everyone out, right? But I think civic engagement requires sustained investment in doing this work and in integrating this work. This is a long-term kind of marathon here. And then I think the other piece is lack of information and kind of engagement around this sense of this being political and kind of taboo work, right? This is all nonpartisan work. We don't tell anyone who to vote for. We don't tell them what party to register for. And so this is permissible work as a 501c3. And so really getting the word out about that, even within our own organization, we're constantly having to do that. And so that is a big challenge to do that widespread. But we have 200 people here that'll hopefully help us with that.
Love that, Lisa. Thank you. Doug, yeah, what challenge or concern?
Yeah, I agree with all of those, that people have to maintain the energy, education, and start, it's not too early to start thinking about 2026 almost. There's still work to do for 24, of course, but you really need to think about these things, 18 to 24 months in advance to really get a good plan in place and be comfortable with all the things you need to do. I think the biggest barrier, at least from getting Medicaid agencies to follow the federal law, is that there's no longer, there were earlier this century, for about 15, 20 years, there were 3 national organizations working on this issue with states, mostly initially in food stamps, but then also in Medicaid and other programs. And those groups have all moved on, and one of them is closed. And so right now there is no national interest group looking out for implementation for the NVRA in these agencies. And that's led to some large declines in numbers. We know from political science that policies are implemented well, in part when there are interest groups looking out for implementation. And when those groups move on, or the funders moved away for whatever reason, baffles me, but they did, these things tend to fall by the wayside again. So that's my biggest concern.
Really appreciate that, Doug. Let's now turn that on around here and now talk about hope. What's the thing that gives you hope in this moment right now? And we'll go in reverse order, Doug, and then Lizette, Manisha.
Well, I think we're still waiting to hear from the Center for Medicaid Medicare Services, CMS, not CSM, CMS. We're still waiting to hear from them about some policy guidance on how to implement AVR in Medicaid. it's like reading tea leaves. You know, a year ago, people were frustrated how long it's taken. It's a year later, and they still haven't done anything. But the rumor is that it will be good guidance, but it's just taking forever. But we need to keep pressure on them to get some guidance out so that AVR Medicaid can work. So that's my almost good news. My other good news is that we know the NVRA and these agencies can work like gangbusters when implemented. It's not expensive. It's a little bit technical, but not hard.
Really appreciate that. Lisa? What gives you hope?
So what gives me hope is the conversation today, right? I think that we are more so now having the conversation around civic health more than I've seen it before, right? I've been doing this work for 20 years. And so, you know, seeing the work that we're doing with the California Primary Care Association, the conversations, you know, with the with NAC as well around really engaging FQHCs in a significant way to create transformational change takes us from civic health being a conversation of a moment to building a movement that addresses civic health at the core. So I'm hopeful that if we can engage all those 30 million FQHC patients to participate civically in every election and every census, that we can literally make this society and this world a very different place than what it is now.
Love that. From a moment to a movement. I love that. Manisha, what about you?
Yeah, I want to agree with what Lizette is saying and what Doug is saying. And I think what gives me hope is just the conversations and constant conversations and pathways, that it's being memorialized in policy. It's being memorialized in how we train our physicians and nurses, and to really be thoughtful about what it means to give our communities voice. And I'm really hopeful that we can actually embed this as a healthcare maintenance component within our day-to-day. Just like what AltaMed does and many FQHCs do across the country, and we can learn from each other. And as we build this movement and then you embed it as being normal, it becomes the way to think about health.
Really appreciate that. There's some really great questions, and now you can see the chat kind of blowing up here, which is great. And so I invite our panelists as well to feel free to get engaged in the chat while I surface a couple questions here. Lizette, you mentioned one of the barriers, and I think each of you touched on this, lack of information or lack of access to information about what's possible, what's permissible. There's a couple questions that came in about the Hatch Act, for example, or, you know, whether some of this work is supporting a political candidate or not. I really wanted to take this opportunity to first, I'll take a pass at this and really invite maybe Doug, Lizette, Manisha for you to chime in on this as well. The questions about the feasibility, the permissibility of this work, and how to navigate that kind of fundamental question. I know it's a constant question that comes up in this space, and it's a legitimate question. The good news is there's some clear answers. So for example, with the Hatch Act questions, the Hatch Act really, from my understanding and being at this work for some time in the healthcare space, it really is about forbidding partisan political activity by federal employees. And the major distinction here is the difference between partisan political kind of activities and non-partisan kind of political activities. And I'm wondering, Doug or Lizette or Manisha, if you wanted to kind of pick up on that as well. A really great question in the chat about what's permissible and Hatch Act and other kind of laws around this.
Well, I think Manisha's group, or maybe Lizette also may have some materials people can look at, but there's been an explosion the past 10, 15 years in the number of groups doing training and how to do voter registration. So if you look online, there's a group like Nonprofit Vote, has been around for a long time, but there's a group called State Voices that may have a coalition in your state working on voter registration. It's not in every state. But if you just look online and find training materials, they can go through that with you. Alliance for Justice is another group that for a long, long time used to have clear workbooks for everybody, that written for not for lawyers, but for lay people to read and understand what's permissible by nonprofits in this area. So look online, get the materials, get the training, get rid of the myths, train your staff. But maybe Manisha and Lizette have a more current idea.
Yeah, I would say, you know, yes to everything, right? So as long as this work is nonpartisan. So the CBOs that do this work that are 501c3s are bound by the same requirements. They also can't, their C4s, their PAC is completely different, right, than what we're talking about here. And so this is all permissible. The advice that I would have for folks is that one of the big challenges for elections is that elections are usually administered on a state-by-state basis. And so really understanding what are the election laws in your state, what are the what is permissible as voter registration in your state. I mean, some of those are by design. Okay, let's put that out there, right? The voter ID laws and all that. But it's really important to understand that, in California, we have the Voter Choice Act, which allows every county to implement the flexibility of having various vote center sites throughout, the election. That is different from other states. So I would highly suggest the Civic Health Coalition has great stuff around really defining what is the law around nonpartisan voter engagement. VoteER has great resources, IRS. And then there was also an executive order that was signed by President Biden that in essence told federal agencies that highlighted for federal agencies that civic engagement and voter registration was important. And so all of the protections are there. If folks have any questions, you can ask us, but as long as this work remains nonpartisan, it is permissible under federal guidelines.
Yeah, so I just want to say from a clinical perspective, right? So I think we don't ask that question when you're at the DMV and you are registered to vote at that place, right? Why is that an issue? Like in a healthcare space, right? So there's a lot of things in healthcare that have opinions, and one of the things that we are trained to do is to check our opinions at the door. Our job is to provide information in the most objective manner. Voter registration is not telling someone how to vote, and we do at Civic Health Alliance, VoteER, we have resources to help people through the nuance of being able to have these conversations, just like many things that we do in healthcare. There's a nuance to a conversation, and so that is what our trainings can do to help people through the nuance of those conversations. But voter registration, again, is not actually actively, we're registering people to vote, actively registering. That's not having you choose to vote at that time. So that is, I think, part of, this space is there's nuance in conversation, just like any conversation, and this should be no different.
Yeah, really appreciate that. I was just reading, I'm gonna read verbatim from an advisory opinion that the Hatch Act unit put out several years ago to request on this matter. Quote, provided that voter registration drives remain nonpartisan, for example, registrants are not solicited on the basis of political party or candidate preference, and there is no advocacy or display of support for a political party or candidate during the drive, we do not believe the Hatch Act would prohibit federal employees from participating in voter registration drives.
Let me say one, if you don't mind, Rishi, one other thing, something Lizette said made me think about how some states are putting in place laws to make voter registration drives harder.
Yep.
So like I said, make sure you find someone who can give you some training and just fill you in on those things.
Absolutely.
They're easy. You just have to make sure. So for instance, you can't take a voter registration application and sit on it for like a month. In some states, you'll get into big hot water for that. So make sure you find someone who can give you a little bit of training about how it works in your state. And then you're good to go. Really
appreciate that, Doug. Thank you. Let's move from voter registration, voter engagement to civic engagement more broadly, the kind of bigger umbrella and the concepts of civic health, for example, is that you talked about and that everybody here has touched on. One of the things that I think there's a question that came in from Dennis Johnson in the chat. It's an interesting kind of question, and it speaks to the question is, should we also consider the value and potential of driving civic engagement through support of Medicaid beneficiary councils having more meaningful oversight role in Medicaid structure, program structure, priorities, and performance? What I take from Dennis's question, and I appreciate that, Dennis, is this question about civic engagement. There's a lot of opportunities for how Medicaid can be leveraged to promote civic engagement. And there's also this interesting thing that I see in Dennis's question, which is how civic engagement is related to governance and just more participation, right, of those impacted and served by Medicaid in the actual governance, not just of their communities, but of Medicaid itself. Jump ball question. Who wants to take a quick pass at that?
Yeah, I would say civic engagement is really defined by participating in civic duty, right? Whether it's representation and leadership, accountability, ensuring good governance. And so these are all, I think, part of that process. It's also making sure that when funding is determined by your state in terms of like the budgets it's dedicated towards, Medicaid or Medicaid beneficiaries, that we're in the process of that we're part of the process of providing public comment, of making sure that they understand that this is important and key, right, to our communities. And so civic engagement is defined broader than just like every election and voter engagement and voter registration. The other important piece here is, for example, census enumeration. The funding that goes into Medicaid, into CHIP, into WIC, into a lot of federal programs that address social determinants of health are determined by formulas that come from census enumeration. And so if census enumeration is not part of the kind of civic health spectrum, it's really hard to secure those federal dollars to come into the particular states and communities. And so civic engagement is defined broader, but it does include that level of accountability, representation, funding. It is all those things. And once you engage, and I know there's research on this, once you engage in one form of civic process, it is likely that you will engage more broadly in your community and call for those reforms, call for those policy changes, and who knows, maybe even run for office, right?
Yeah, I really love that continuum and that point that it's building civic efficacy, really the ability for someone to kind of now exercise more of that civic muscle individually and as a collective in the community. The last kind of question that I think is really kind of a pressing question, I'm sure, for a lot of folks who are dialing in today is, how do you actually fund this work? How do you sustain this work? Where does it come from in that kind of way? And I know that's a question that comes up episodically in election years, but is obviously an ongoing question as well. I know that there's a lot of different ways in which that funding question is kind of tackled. When I invite maybe Manisha and Doug and Lizette to kind of go last quick round robin question, then we'll make some room for a wrap up.
So I think I will start from a lens of training, and some of this doesn't require money, it just requires will. And really being thoughtful about conversations. So when I train residents and medical students, when I do clinic with them, I ask them the question on how did they ask about if they're registered to vote. Some of that didn't cost me anything to do that, right? And really, to be honest, there is a sustainable thing that requires investment, and part of funding is showing that you're walking the talk. And I think that's really important, because that means you value what it is that we're doing. But some of this really doesn't require any money. It's just a matter of getting people to see things a little differently, and being able to give them a tool on how to do that within their space and place with healthcare delivery. So I do believe the funding wholeheartedly is important, because it is a way that we value in society how people invest in something. That means you're putting your footprint on it, but there's other things that don't require any money.
Thanks, Manisha. Doug, is that any quick comments on that?
I think what I would just, I agree with everything that Manisha mentioned. And then what I would add is the big challenge is like public funding is non-existent for much of this work, exception of the census. Usually the states come up with their complete count committees and all that. And so it makes it very challenging to do this work, because there is still that common misconception, right, of like elections, it's not a federal funding issue or a state funding issue for the most part. And so there's a huge reliance on private funding for this work. So a call on philanthropy, right, and a call on private funders who do have the opportunity to fund this work. I know on the FQHC side, some FQHCs like Ultimed can do this work despite whether they're, being available funding or not. But there are smaller FQHCs that really want to do this work and are sometimes challenged with staffing, right? We all have staffing issues, et cetera. So this will be my call to action for philanthropy and for any donors who can contribute to this work. It is definitely needed.
Well, thank you. And Doug, I think I'm going to apologize to you for not giving the last word in, because we have just 60 seconds left. So I'm going to go to the last slide here with next steps and letting people know if we can share screen really quick. There are some next steps here to complete the follow-up survey that you're going to get as soon as this webinar is over, so it'll pop up in your browser. Please stay on just for 30 seconds to complete that. Please also share your favorite moments and insights from the webinar and social media, both with our panelists kind of tags as well as Health Begins. Take action, many different concrete kind of tips, starting points to even just learn more about this with the resources. We'll be sharing the resources as well as the slides that the panelists put together in the post webinar email that goes out. So look for that, some additional resources from our friends at not just Civic Health Alliance, Vote ER, and many others that are here that we'll include, and then stay engaged with us. Check us out at Health Begins at any point if you want to stay engaged in ways to think about how to move upstream and advance health equity. With that, I'll say thank you to Doug, to Lizette, to Venetia for all of your support. Here's some resources on the screen from our friends at Altamed in the next slide as well. I think there's some information as well about the upcoming webinar that Civic Health Alliance is running on May 30th as well. So healthcare worker training and civic engagement is coming up. And then last but not least, I think the last slide is our way of saying, please stay tuned with us. Health Begins has a webinar coming up on June 11th about health, housing, and justice work based on our landmark work with Kaiser Permanente across the country, establishing medical legal partnerships. So please stay tuned for that. And then I think with that, that is my cue then to the last page to say thank you. So thanks to all of you, and we'll be in touch. Please stay on to complete the survey. Be well.